Hello, my friend. I'm Dr. Linda Parker, and today I want to talk to you as if we were sitting together at the kitchen table, not in a cold hospital room. For years, you've been told that at a certain age, vaccines become mandatory. You show up, roll up your sleeve, and hope for the best. On the other side, you may now hear people say, refuse everything. Both messages treat you like you can't think for yourself. That ends today. If you are over 75, your body, your immune system, your medications, and your daily life are very different from when you were 50. Yet many checklists still treat you as a generic senior. Flu shot? Automatic. COVID booster? Automatic. Pneumonia shot? Automatic. New vaccines like RSV or shingles? You must get them because of your age. What almost nobody explains is that your age is only one piece of the puzzle. Your health history, your current conditions, and your goals for the years ahead matter just as much. In this conversation, I'm not here to scare you, and I'm certainly not here to tell you to refuse life-saving vaccines. Vaccines have prevented countless deaths from flu, pneumonia, COVID-19, and shingles, especially in older adults. They are powerful tools. What I want is something different. I want you to feel confident asking smart questions before saying yes, so that every shot you accept has a clear purpose in your life, at your age, in your situation. We're going to look at 4 vaccine categories that often get presented as mandatory after 75: the annual flu shot, the COVID-19 booster, the pneumonia vaccine, and the newer for seniors shots like RSV and shingles. You'll see that mandatory isn't really the right word. The better word is worth discussing carefully. For each one, I'll show you what it does, why it's offered, and the exact questions you can bring to your doctor to turn pressure into partnership. Before we go one by one, a quick reminder: this is education, not personal medical advice. I can't see your test results, your scans, or your full history. Only your own medical team can do that. What I can give you are words and ideas you can use in your next appointment, so you are no longer a silent patient, but an informed decision maker. Let's start with the one you hear about every single year: the flu shot. Influenza may sound like just a bad cold, but in older adults it's a very different beast. As the immune system ages, it becomes slower and less flexible. A virus that means a week in bed at 40 can send someone over 75 to the hospital with pneumonia, confusion, and a long, exhausting recovery. That's why public health agencies strongly recommend annual flu vaccination for adults over 65, with stronger high-dose or adjuvanted formulations for this age group, because they generally provide better protection than standard dose vaccines in older adults. Ontario.K+3, CDC+3 BC, CDC.ca+3. So where does questioning come in? First, timing. Flu viruses change from year to year, and protection from the vaccine slowly fades. For someone over 75, a shot given very early in the season might be less protective by the time viruses are peaking. You can ask your doctor, when is flu expected to circulate where I live this year, and what's the best month for me to get my shot so it covers that period? Second, formulation. Not every flu vaccine on the shelf is designed with older adults in mind. You have every right to ask, is this the high-dose or adjuvanted flu shot that's recommended for people my age, or just a standard dose? That single question can change which vial ends up in your arm. Third, your past reactions and current health. If you had a strong reaction in the past, high fever, severe aches, or a flare of a chronic condition, that history matters. It doesn't necessarily mean never again, but it does mean the next dose should be planned thoughtfully. If you're recovering from surgery, fighting a major infection, or adjusting heart or kidney medications, it might make sense to coordinate timing instead of squeezing the vaccine into a chaotic week? These are not rebellious questions. They are responsible questions. I once worked with a 79-year-old woman who always took the first flu shot available, often in late summer, just because the pharmacy called. She still ended up in the hospital one winter with severe pneumonia. When we reviewed her pattern, we didn't abandon the flu shot. We improved the strategy. The next year, she received a high-dose flu vaccine, timed closer to peak season, and coordinated with her heart checkup. She still caught minor colds, but she avoided the intensive care unit. The difference wasn't magic, it was planning. Now let's talk about the vaccine that has dominated conversations in recent years, the COVID-19 booster. Many older adults are exhausted by this topic. First doses, second doses, boosters, changing brand names, new variants. It can feel endless. It's tempting to say, I'm done. No more. But it's important to remember that age remains one of the strongest risk factors for severe COVID-19, hospitalization, and death. Updated vaccines are designed to better match circulating variants and continue to reduce the risk of severe disease, especially in older adults. PBS+4 CDC+4. Organización Mundial de la Salud +4. The key is not to keep collecting doses like stamps, it's to time them wisely. One crucial question is about your history. How many COVID shots have I had, and when was my last one? Have I had COVID recently? If you recovered from an infection a few months ago, your immune system has just been stimulated. Your doctor may recommend waiting a certain interval before the next booster so that it adds to your protection instead of piling on during an already active immune period. Next, consider your personal risk. A 76-year-old who lives in a nursing home, shares air with dozens of people, and has multiple chronic diseases is not in the same situation as a 76-year-old who lives with one partner and spends most days gardening. Both can benefit from vaccination, but their exposure and vulnerability are different. A powerful question to ask is, given my day-to-day life, who I see, where I go, my heart and lung health, how strong is the case for a booster right now? There's also the question of how many vaccines to take at once. Some guidelines allow combining COVID-19, flu, and RSV vaccines in the same visit, and for certain high-risk people, getting everything done at once is practical and safe. IDSA +1. But you are allowed to say, I'm over 75, I'm worried about fatigue and side effects. Can we space them out? If your doctor understands your concerns and your overall risk, you can create a schedule that protects you without overwhelming your body or your peace of mind. The third big category is the pneumonia vaccine, more precisely the pneumococcal vaccines. These are designed to protect against Streptococcus pneumonia, a bacterium that can cause severe pneumonia, bloodstream infections, and meningitis. In older adults, these infections often lead to hospitalization, loss of strength, confusion, and sometimes a permanent step down in independence. That's why many countries recommend pneumococcal vaccination for adults over 50 or 65. Today, there are newer conjugate vaccines, like PCV15, PCV20, or PCV21, depending on where you live, and older polysaccharide vaccines, and schedules that combine them. Canada +3 CDC +3 CDC +3. What should you question here after 75? The first question is very simple and very powerful. Which pneumococcal vaccines have I already received and when? Because schedules have changed over the years, many older adults have had one or more doses without realizing they've already completed what today's guidelines consider adequate. When you switch clinics or pharmacies, that history can get lost. If no one checks, you may be offered another pneumococcal shot simply because your age triggers an automatic reminder, not because you truly need more. The second question is, According to the schedule you're using, does another dose give me clear additional benefit at my age? In some situations, guidelines now use shared clinical decision-making, meaning your doctor should sit down with you, look at your past shots and current diseases, and discuss whether another dose is reasonable or optional. Your immune system doesn't forget every few years. If you've already received a modern conjugate vaccine that covers many strains, the need for further doses might be limited. On the other hand, if you've never been vaccinated against pneumococcal disease and you are over 75, a single conjugate vaccine can provide important protection. I remember an 80-year-old patient who brought a folder full of vaccine cards to her appointment. Tucked in between old flu stickers and travel vaccines were 2 pneumococcal doses given years apart. Her pharmacy was urging her to update her pneumonia shot again. When we pieced together her history, we realized she had already been covered under the new schedule. What she truly needed wasn't another needle. It was a clear plan for early evaluation if she developed fever and cough, and good communication with her family, so they would not dismiss serious symptoms as just old age. The vaccine had done its job. The rest was about vigilance. The fourth category is what I call the new seniors shots, especially RSV and shingles. Let's start with RSV, or respiratory syncytial virus. For years, it was mainly discussed in relation to babies, but we now know it can cause serious lung infections in older adults as well, leading to thousands of hospitalizations and deaths in people over 60 each year. Recently, several RSV vaccines have been approved for older adults. Current guidance in some countries recommends a single RSV vaccine dose for all adults 75 and older, and for adults 50 to 74 who have additional risk factors. It is not an annual shot at this time. JAMA Network +3, CDC +3, CDC +3. Because RSV vaccines are new, many people in their 70s hear about them for the first time at the pharmacy counter. That can feel unsettling. Why have I never heard of this before? A good starting question is, given my lungs, heart, and general frailty or robustness, how much risk does RSV actually pose to me? If you have chronic lung disease, heart failure, kidney problems, or live in a long-term care facility, the risk of serious RSV infection may be high enough that the vaccine is strongly recommended. If you are relatively robust, live with 1 or 2 people, and rarely encounter crowds, you may still benefit, but the urgency may feel different. The decision should be a conversation, not a sales pitch. Now let's talk about shingles. Shingles happens when the virus that caused chickenpox in childhood wakes up again later in life along a nerve, causing a painful band-like rash. For some older adults, the pain lingers for months or even years in a condition called post-herpetic neuralgia. Modern shingles vaccines, specifically the recombinant zoster vaccine, are more than 90% effective at preventing shingles and its long-term pain in adults over 50, with strong protection even in those over 70. ShingrixCP.com +3. New England Journal of Medicine +3 PMC +3. After 75, the main questions about shingles vaccination are timing and expectations. First, timing. If you are in the middle of chemotherapy, recovering from major surgery, or dealing with an unstable medical condition, your doctor may want to coordinate the shingles series with other treatments. Second, expectations. Many people experience a day or two of fatigue, chills, or muscle aches after shingles vaccination. For a 78-year-old who lives alone, this can feel scary if it comes as a surprise. So ask, what side effects are common for someone my age, and how can I prepare? Maybe you schedule the shot for a day when a family member can check on you, or you clear your calendar so you can rest. There's an emerging piece of science that is fascinating and hopeful. Several large studies suggest that older adults who receive certain vaccines including shingles, may have a lower risk of developing dementia or of dying from it if they already have the diagnosis. The exact reason isn't fully understood. Preventing severe infections and reducing inflammation may play a role. But the pattern has appeared in multiple countries. Reuters +1. These findings do not mean get a vaccine and you'll never have memory problems, but they reinforce a beautiful idea. Protecting yourself from infections in your 70s and 80s isn't only about avoiding hospital beds. It may also help preserve your thinking and independence. At this point, you might be thinking, Linda, this is a lot. How am I supposed to sort through all of it when I'm standing in front of a pharmacist with a form? So let me give you a simple 3-question tool you can use for any vaccine you're offered after 75. Question 1. What disease does this vaccine protect me from, and how serious is that disease for someone my age and health? You want a clear explanation of what you're trying to avoid: hospitalizations, pneumonia, long-term pain, ICU stays, not vague phrases like, it's recommended. Question 2. Given the vaccines and infections I've already had, how much extra protection is this going to give me? This forces the conversation to look at your history. If you already had COVID, received several doses, and had a recent booster, the timing of the next shot might change. If you've never had a pneumococcal vaccine, a single dose might be a high priority. If you already completed a full schedule, another dose might be optional rather than essential. Question 3. What short-term side effects are common at my age, and how can we plan so I feel safe? Maybe that means spacing flu and shingles instead of taking everything together. Maybe it means scheduling a quiet day after the shot. Maybe it means calling your daughter and saying, I'm getting vaccinated on Thursday. Can you check in on me Friday morning? When side effects are expected and planned for, they are far less frightening. There's one more important piece. Infection prevention doesn't begin or end with vaccines. Good hand hygiene, well-ventilated rooms, fast response to early symptoms, and responsible antibiotic use all matter enormously in older adults. Health leaders around the world have emphasized that infections are now one of the major threats to quality of life in older age, not just from dramatic illnesses like COVID-19, but from everyday infections that can tip a fragile body into crisis. The Guardian vaccines are one pillar of protection, not the whole building. So let me bring everything into a single sentence for you. After 75, the wisest way to think about vaccines is neither blind obedience nor blanket refusal, but thoughtful partnership, using these tools when they clearly protect your independence and asking questions when the benefit is less obvious. You are not a checklist. You are a person with memories, responsibilities, maybe grandchildren, maybe a partner who needs you, and dreams for the time you still have. Protecting that time is worth a few extra questions. Never let anyone tell you it is too late to protect your health or to understand your options. Your immune system is older, but it still learns. Your mind might be slower, but it still understands. Your voice might be softer, but it still has the right to say, "Explain this to me. Help me decide. Let's choose what makes sense for me." If this conversation helped you see vaccines not as orders to follow or enemies to fear, but as tools you can evaluate calmly, then let this be the beginning, not the end. Bring these questions to your next appointment. Ask your doctor to review your vaccine history with you. Talk with your family about your priorities, staying out of the hospital, protecting your brain, avoiding long-term pain. And if you know another person over 75 who feels pressured or confused about all these shots, share this message with them so they can feel a little more in control too. I'm Dr. Linda Parker. Thank you for spending this time with me. Remember, you are not powerless in front of a syringe, a schedule, or a system. With good information, calm questions, and a bit of courage, you can say yes when a vaccine truly protects your future, and not yet, when it doesn't add much to your unique story. And if you'd like to keep learning how to make confident, informed decisions about your health in this stage of life, I'd be honored to see you in the next video.